let us now proceed to our knowledge sessions. And the first session for the day is Breakthroughs for Health with Clean Air. From depleting ozone layers to increasing levels of air pollution, the situation is becoming a grave challenge to the nation. We need to build physical, mental, and national capital through better practices that help in air quality management to eliminate it as a source of lung disease. We depend on innovations in the worlds of science and of policy to help make our air clean again. To discuss this, I call upon the moderator of this session, Dr. Bobby John, Managing Director of Equitas Consulting. Dr. John, thank you so much for agreeing to moderate the session. I would request you to please come up and take your place on the stage. I would now like to introduce and invite our panelists one by one, please. Mr. Hemant Goswami, social activist, public health and civil rights issues. Mr. Goswami, thank you so much for agreeing to be a part of this session. Welcome. Our next panelist, Mr. Barun Aggarwal, CEO and founder of Breathe Easy Labs. Mr. Barun Aggarwal, thank you so much. Welcome, and thank you for being a part of this session. I now invite Mr. K S V Sagar, Managing Director of Camphil Air Filtration. Mr. Sagar, thank you so much for being a panelist and for joining this session. And finally, I invite Mr. Suyash Gupta, Managing Director of the Indian Auto LPG Coalition. Mr. Suyash Gupta, thank you so much for joining this panel and for attending the session. Thank you. Dr. Bobby John, I now hand over the session to you. Thanks.
I will start with Dr. Goswami. Your conversations, your work so far, and even the description that we've heard of you, tells us that your work has focused also on indoor air pollution, which is not where men are to be found or being affected by it. So let's start with that. What's the impact of air pollution inside homes on women and children?
When we talk about air pollution, we generally think about vehicular pollution and other kind of pollution, maybe smog and all that. So we think about that. We don't think about indoor air pollution, which comes from tobacco smoke and household fire burning and chulas and all that. So we don't even think about that.
And so when you say tobacco smoke, it's men who are smoking and they're blowing it.
It's not necessarily men. It's around, still as of date, the percentage is low. The reported percentage is around 3% female smoke. Okay, so and around 22.5% is the tobacco consumption among males. So certainly the share of males is much higher. But people who are affected, it's not just limited to males.
Sure.
Secondhand smoke is one of the number one killer in household. So if females are there, children are there, we don't even think about that. And when we are so much concerned about outdoor pollution and things like that, but you see people line up before the shop to buy pollution. So they are lining up before the shops, they are paying for it, bringing it to their rooms, smoking over there, and you have children, women, everybody affected over there.
So the classic example, or classic explanation of a cigarette being fire at one end, a fool at the other end.
That's what Bernard Shaw said.
Right.
That's correct. To a large extent, you can say that. If you, in the present scenario, if you see, so you can say that it's like that.
So there's a fire at the one end, a fool at the other end, and there are victims at home that are women and children.
That's correct. That includes, it's not only women and children. Even the person who's smoking is not only inhaling tobacco smoke, he's also inhaling second-hand smoke also, because
Sure.
you are doing both. You are sucking the cigarette, so you are inhaling, you're taking that air and a toxic chemical, which is 4,000, concoction of 4,000 chemicals. Okay, you're taking that in with around 70 carcinogens in it, cancer-causing agents.
Sure. Beyond tobacco, there would be also the cooking mediums and things that are also causing indoor air pollution.
Absolutely, yeah. Indoor cooking and all that, with, where you don't have LPG, where you have firewood and all that thing. So because of that also there's a lot of indoor air pollution. So I think that's another number two.
And the design of homes, which is not conducive to the movement of air from outside within, and within outside also contributes to the concentration of polluted air inside homes.
Absolutely correct here again. If you see the design of all the urban housings, which you call the low-income group households or even the slums and all that, if you go to unauthorized colonies and all that, you basically have a very small room which would be like less than 150 to 200, something like 150 to 200 square feet, and the kitchen would be even smaller than that in many times. So women are the one who are affected the most in such a scenario. And I think there's another stats which I must share with you, and I think that should surprise everyone. When we think about air pollution and things like this, we think it's an urban phenomenon. And when we talk about Delhi, we think it's happening only in an urban city like Delhi or maybe Bangalore or maybe Mumbai or something like that. But I was looking at the mortality statistics. So Ministry of Health comes out with mortality statistics. You can go to the Ministry of Health website where you will get the latest mortality statistics is 2010-2013. And if you look at the mortality rates caused by, I have it over here, by respiratory disease. So rural is 8.1%, okay, and urban is 6.2%. So urban is way below rural. And if you consider that around 65 to 70% is rural India, so just translate what is 8.1 in rural compared to 6.2 in urban means. So that means more mortality is caused due to respiratory disease in rural area. Similarly, respiratory infection, if you see rural India, it is listed in one of the top 10 causes of death. Top 10 causes of death, one of them is respiratory infection in rural areas, which is around 4.1%. But if you see it in urban areas, you don't find it is not in the top 10 cause of mortality. So if you look at this, so you realize that the problem is as severe in rural area as it is in urban areas.
Thank you, Mr. Goswami. We assume that when we step inside home, close the doors, we are in a safe space.
That's correct.
What you've essentially done is to disabuse us of our notion that when we step inside our homes, we are not necessarily safe. It's an illusion, because what we bring from outside, things that we buy, say tobacco, or the things that we use for fuel inside, are all contributing to a very polluted environment inside homes, and it's not any safer than trying to close the door on the external world outside.
That's a correct summary of what we
also, that what we have created, this ashiana that we have created, this notion of security that we've created, is also faultily designed in such a way that it does not enhance health. In fact, it might be actually a cause for ill health. Thank you very much for that opening summary that allows us to kind of set that context in which this conversation takes place. Because if it's not safe inside our own homes, when we step outside, particularly for those of us that live in Delhi over the last couple of months, and every year around this season, we say we open our doors and it's even more grim. It's dark and we can't see the sun, we can't see the stars, and we can't breathe. It's worse outside. Numbers may actually tell us that indoor air pollution might be worse. We'll come to that a bit later.
One more point I must add over here. Yeah. Pollution is not reported as a cause of death, but let me tell you, respiratory diseases, it is listed as a cause of death.
Sure.
And number two, tobacco smoke is now well known. In case of, WHO and Ministry of Health releases that.
And we'll come back to that.
It's 1 million deaths, 10 lakh people in India every year.
Sure. We'll come back to that. But the point being that homes are not safe. When we step outside, we think that we'll get some fresh air. People say, let's step out of our office, let's step out of our home, let's go for a walk. We'll take in some fresh air. It's not really any more fresh. It seems to be a lot more grim out there. At least the visual of it is fairly stark. So let's start with you. Where do you think people are going to go to get a sense of breathing easy? If I may kind of take your own brand name.
Thank you, Dr. Bobby. Before I answer that question, if I may just correct one statistic. I'm being facetious about it because I was with Dr. Arvind Kumar, who's one of the leading pulmonary surgeons of India, and he said, Barun, 100% of people living in Delhi are smokers. The moment a child is born, he is a smoker because of the fact that he is born in Delhi. And I would extend that to most parts of India. So the statistic that only 2 or 3% of women smoke and 22 or 23% men smoke. Agreed, I'm being facetious about it. Living in Delhi, we're all smokers. Our lungs pretty much become black, just like any other smoker's lungs. And within a few years, we also sometimes feel the symptoms of the pollution that we are breathing in, just like a smoker would feel the same thing.
So how do we breathe easy?
So coming back to your question, you're absolutely right. When people talk about perhaps going out for a walk to get some fresh air, especially in the morning time in the winters, they don't realize it, but in a sense, they're making it worse for themselves. The particulate matter levels outdoors, because it's grim, in the wintertime you can actually see it. I drive from my home to the Sanskriti school every morning, and I pass through the President's Estate and India Gate, and I cannot see India Gate from the President's Estate. The visibility is completely gone. Whereas I can see India Gate very clearly during the monsoon time. So that visibility issue, that's what is blocking the view, is the particulate matter in the air. And that is what we are breathing in. At short distance, we are not able to see it, but when you see further away, you can see it. So when you go out in the morning, you're actually breathing in levels that can be 10 to 12 times higher than what is even inside your home. Not that your home is safe unless you've done something to fix it, but there is no safe place in Delhi unless you've actually done something proactively to fix the air quality for yourself.
So sorry for interrupting, but so when you said that in monsoons, you are able to see India Gate from Rashtrapati Bhavan, and during the winter you can't see it. Is it that we should be praying for monsoons year-round in Delhi? Is air really safer during the monsoon times vis-a-vis the winters?
Absolutely, yes, it is safer. It's not perfect, but it is definitely safer. In the monsoons, the particulates come down, the pollutants come down because the rain washes it away. But in winters, I mean, in Singapore, it rains they call the 4 o'clock rain. It rains every evening at about 4 o'clock, and they have pretty clear air. If we had, I mean, it's difficult to produce that. If we had rain every evening at 4 o'clock, perhaps Delhi's problems would go away as well.
Let me ask Dr. Goswami one thing. It's safer when it's raining during the rain season, but it's comparative, right?
That's correct. That's correct.
And so year round, if we go right through the years, how bad is it at a baseline level?
Okay, see, on November 30th, I was looking at the pollution statistics. So November 30th, I was looking at AQI index, and Anand Vihar, it was 999, which is the instrument limit. Instrument limit is up to 999. It cannot capture more than that. On 30th November, anyone can go to archival data of pollution. It was 999. And maximum AQI can be 500. It was 500.
July 31st?
November 30th this year.
November 31st. November 30th.
Yeah,
No, I'm looking at
30th.
seasonal variations because
Okay.
I'm trying to drive it
And
backwards.
every year,
Yes.
every year, if you take out the history of Delhi, so in these 2 months, it's like this only. So everything is not being contributed. I mean, if we say it was because smog was coming from Punjab, because there was stubble burning, there was something like that, it is coming from vehicles and all that. But I also looked at the statistics of Punjab. Punjab, Ludhiana air quality, Panchkula air quality, Chandigarh air quality, Gurgaon air quality, it was better than Delhi. So if it was coming from stubble burning, that should have been higher. It was not higher.
That was not the point that I was trying to drive at. The question that I'm having, and then I'll turn to you, Suyash, in a second, is that when we see it, we worry about it. When we feel that there is air pollution out there, we look at the AQI index. But the point being that it isn't any cleaner, or it's relatively cleaner, but
On
not
other days
by,
also.
not by all that much a factor during the rest of the year, because we have a certain amount of rain, it cleans out, it scrubs clean, and so therefore it appears a little bit better.
So just to put it in perspective, last year we had a total of 3 days in the full year when we had the AQI at a good level for the average.
Thank you very much. That was what I was looking for. Out of 365 days, there were only 3 days that we had clean,
Good
good
level.
air. And this was 362 days that we didn't have it. Most of the days it wasn't visible. It's only during a particular time of the year that it becomes visible, and therefore we kind of get really, really upset about it. We seem to have an advantage. Some 15 years ago, Delhi as a metropolis and India broadly writ, in Delhi being representative, that we began saying, you know what, automobiles cause pollution, and so therefore we need to both phase out old ones, we need to also look at cleaner fuels, we need to try and get a whole revolution in terms of CNG buses and stuff like that, and Delhi reaped a benefit. Where did that all go? Where is this trajectory going?
Well, that's a good question, Bobby, and thanks for asking this. This has been a very sensitive subject for the, particularly the clean air movement, the NGOs in Delhi. Did we really gain out of the CNG movement? That's very questionable.
So you're questioning whether we made any substantial gains with the CNG movement itself?
Absolutely.
Okay.
Absolutely, I am. And if you look at the global picture, it's just that we embark on a path and without contemplating, without looking at success stories globally and without doing any pilot study, we just go all out for that. Even the EV narrative which is building up today.
EV being?
Electric vehicle narrative.
Electric vehicles. Okay.
Which is building up today. Are we really gaining anything out of that? If we compare the well-to-wheel emission today, we will actually be emitting more CO2 in the environment if we convert all vehicles to electric. Today, 68% of Indian electricity is obtained from fossil fuels. Coal, natural gas, all these are fossil fuels. So natural gas is, yes, a bit cleaner than coal, certainly a lot cleaner than coal, but again, 68% of natural gas, 68% of electricity is sourced from fossil fuels, and so on a well-to-wheel emission basis, we are polluting more than we are doing today.
On a well-to-wheel emission basis, which means now the wheels may not be polluting, but the source head might be polluting an equal amount or perhaps more.
Absolutely. So we'll be probably cleaning up Delhi, Kanpur, cleaning up the top 10, 20 cities just a bit, and we'll be polluting the power-producing areas
so
much more.
Korba might be down there, Talcher might be down there, Ramagundam might be a little bit more.
So we're just shifting the source. We're just shifting the problem. We're not actually trying to find a solution, a long-term solution towards this problem.
I don't completely agree with that because moving the emissions from the tailpipe to the coal-fired power plants is actually a big step in the long-run fight against air pollution. Your direct exposure from a population perspective because of the tailpipes is direct, right at the tailpipe. Lots of people are there on the roads. The population is there in the cities. You can actually control your emissions at the coal-fired power plant by doing the right kind of filtration technologies and reduce the polluting effect as long as the law, we already have the law, as long as enforcement of that law is done correctly. But in the long run, I agree with you that we need to move from that coal-fired power plant to other sustainable forms of energy, i.e. solar or wind or hydro, so that our electric vehicles can get there. But we have to start at some point. If we delay it saying, first let's get our coal to electric and then we'll get EVs, we'll never ever get
there. So
there.
the point that both of you are making is this, that yes, there is a problem with the thought process that we can move to cleaner emissions by moving to gas in the automobile side, but the ability to control as many emissions from millions of units to tens of units would be a lot more better if we had better enforcement of our emissions at our production end, and that also needs to be then followed up with a transition to better ways of producing the energy. So are those 2 points that
absolutely. I mean, the context of my statement was, there's two parts to it. A is, yes, electric vehicles are going to be cleaner. But we are talking about, is it going to make any difference today that we are forgetting all other alternate fuels available today? We have natural gas. Natural gas is cleaner, yes. It's certainly cleaner than petrol and certainly cleaner than diesel. Diesel is a known carcinogenic. So we have, electric is going to be it's 15 years away at least, because all new vehicles will convert to electric. So we have an existing vehicle population and we do not have any solution for that. And what our research has shown in the past year and a half, ever since the narrative of electric vehicles has taken shape, it takes about 250 to 400 crore rupees investment for a city to go to a CGD network for CNG distribution. Now,
sorry, the number once again, 250 to 400 crores
yes.
to go to a CG, a compressed gas network.
Yeah, compressed gas network for vehicles, yes.
Okay.
So, but that's the kind of investment it takes only on pipelines, and then you have additional investment on setting up each CNG station, which is about 2.5 to 3 crores, anyways.
Right.
Now, what is happening is the return on investments for the marketers of the fuel is typically a 7 to 10 year time frame for people who are into the CGD sector. Now, with the huge EV narrative building up, they are all extremely skeptical, and apart from the PSUs like IGL or MGL or government GAIL promoted entities, they are all stopping their investments. If you look at the PNGRB website in terms of cities which are notified to come on the natural gas network and cities which actually get notified, get CNG, it's a gap of 10, 12 years because nobody is, today, you will see no new investment coming up from that sector. So, What do we do for these 15 years? Do we just sit idle and wait for electric to come in and do not have a solution for the existing vehicles? I think that's where we're missing the point.
So let's hold that there. And I just did a bit of math while you were doing that. This is why you had a little bit more of a run without me interrupting you. We are in the middle of this giant conversation in India saying we will have 100 new smart cities, right? And they're going to be characterized by both urbanity and access to services and things. And I've been always asking this question, a smart city ought to be a healthy city. And one of the things would be a better air quality. And here you're telling me that it takes between 250 and 400 crores to just line up a city before even the first pumps come in.
Absolutely.
For switching over to CNG. And then a similar order of magnitude for probably the electrification and electric vehicles. Multiply that by 100, we are talking about some 40,000 crores. Is that what we have invested, or is that the scale at which the policymakers and our budgetary allocation processes have put into this smart city conversation? Clearly not. That number I haven't even seen that number anywhere. And so that to me is a big, serious question mark, even in our aspiration to get to a smart city, which is being sold to all of us. Take a pause. I turn to the audience. What's the air quality index outside right now? Anybody? Any guesses? And I'm looking at the organizers for handing out a prize for anybody who gets nearest to the tens of it. Okay? Sir? 200? He's not qualified to answer that question? No, he's not qualified to answer that question. You're being disqualified by somebody here. Sorry, sir. Sorry, very poor? Very poor. Yes, ma'am. 460. Did you Google it just now? No, you haven't. Did you pass by an air quality meter? You just live here, right? What do you think is the AQI inside this room right now? Anybody? Poor? Get it to the nearest tens and I will give a prize from my pocket. 360? Sorry? 330? Well, yes, sir. 1440. Again, you're disqualified. Just before walking in onto the stage, the gentleman does have the right numbers. Its outside is just over 200. And the reason why we know that it's 40 or lesser is simply because we've got a machine running at the back. For those of you that haven't had a chance to look, I hope that you will have a look at that giant piece of equipment that's sitting inside this room, which we had to cart in, courtesy Mr. Sagar and your company. It costs a lot. It's not one of your small little air purifiers that you run at home. That takes a lot of electricity, and it's a demonstration that it's very, very expensive to get that kind of clean air. It doesn't take a lot of electricity? Fine, I'll come back to it. But on a periodic basis, running it at home, it's going to be expensive. Point being, we can get clean air, but it's expensive, but it's only going to be inside the house. Mr. Sagar, is this even feasible? What the technology that you're demonstrating here, is it even feasible outside this door?
Perfect. First thing, I'll just add to this outdoor air, even though, I'm coming purely from the perspective of a filtration company. And just for the people uninitiated to our company, Camphil is a Swedish company by origin. So we are a subsidiary of Camphil in India, 50-year-old company into end-to-end solutions for air filtration for man and machine. We also handle machine as well as man and as far as comfort air is concerned. Now going back to the outdoor air, in addition to what all the three gentlemen said, there's a big other pollutant is per se industry. I'm not getting into the segment of industry of power or whatever, even a general industry. You know what? Every industry does generate dust through the manufacturing process. Now, as a part of the whole package, they need to have dust extraction systems to collect this dust, recycle it. Unfortunately, in our parlance, we call a dust collector purchase as a grudge purchase. That's the last purchase any industry wants to do. Where do you keep that machine? Right outside the gate at the exit in the back where no one can see it. So it's the most, a machine which is not really wanted by everyone, but a machine that can really change the addition of additional pollutants from industry onto the outside.
Why don't people want to?
Because
why is it a grudge purchase?
Because you know, they just want to invest on an equipment which is going to handle dust. I mean, per se, dust is something they don't, an industry, they say, okay, we have certain norms, we meet it on paper, but really not set up the good dust extraction system to take care to pollution levels that are actually required of emissions from pure dust.
So, to the two people who work on policy side, how can we take a grudge purchase and make it into both a purchase that is mandatory and something that is not grudged anymore? How can we kind of transform that?
Bobby, I think I would like to take you to the Occupational Safety Act also. Okay, so there's a thing called Occupational Safety Act.
Correct.
Unfortunately, in India, we don't have anything like OSHA, which is Occupational Health and Safety Standards in India. It is a part of the Factories Act. Factories Act is 1940s Factories Act, and it comes from the realities of the Second World War. So we, as of date, has an antiquated instrument of law where you only take care of workers who slip on the floor or who there's an oil spillage or something. So we only take care of that. Nobody takes care of air pollution, water pollution, safe drinking water, or even carcinogens, which are other carcinogens which are there in any industry or any working atmosphere in a work area. So I think there's an urgent and a dire need to work on area of occupational safety. And occupation should not be limited only to factories. Today, factories they are equivalent to service industry. So you go walk into an office, you walk into some other any kind of work area, or even a kitchen of a hotel or something. So you need to have safe standards for that.
So we have a grudge purchase, we have antiquated laws. Barun, how would you go about negotiating a space where we all can take a deep breath of clean air?
I'm going to link what our politicians earlier said to this conversation actually. What has my country done for me is not the question I need to ask, but what is it that I can do for my country is what I need to ask.
Okay.
Because we have some of the most stringent environmental emissions laws for industry in India, even as compared to some of the West. And if we have very stringent laws, the problem is the enforcement of that. We don't have very good enforcement, and I, as a citizen of the country, find it very easy to flout the laws that are already there. And that's where I come back and I say, what is it that I can do for my country? And if each one of us who runs factories, who runs industry, can actually take that on as a responsibility, I think it will go a long way.
So is there a disconnect between
Sir,
the environmental law?
There is an addition over here.
Sure.
I mean, what he's saying is talking about pollution control boards take care only of the emission. What goes outside, it does not take care of the indoor part. So that there is a vacuum, legislative vacuum.
Fair enough. I understand that. But just to continue on that, we have stringency of laws. Some people may actually play around with an antiquated act and kind of find a loophole within it. And there is a whole thing about why should I spend money unless somebody kind of actually comes and bangs my head on top of it. You are saying this idealistic thing that let's find out what we can do for our country. Nobody does anything for the country. We all do it when our skin is in the game. And currently, all of our, not our skins, but our lungs and our brains are on the edge right now. Given the situation where we are at. How do we transform this? And that's a conversation that people are here for. I mean, we have made the problem statement. How do we actually move from here going forward?
Yeah, I go back to your original question. Why, can you afford this machine? Why do we need this machine? I almost call this the ventilator, this air purifier.
The size, it
The
approximates one. It approximates one.
The
Yes.
pure machine is a ventilator. Why have we gone to a stage where we need these ventilators? The reason is, fine, we have talked about the outdoor air and some policies are working towards the outdoor air. Can you imagine an indoor air where we spend 80% of our times can be as bad as 5 to 50 times the outdoor air quality? So to protect that, we have ventilation systems, at least in good commercial buildings. And what have we done to those ventilation systems? We have air handling units put in those buildings, and Barun will surely agree with me, he is a crusader for that. And what filters do you put in there? The cheapest wire meshes which probably stop mosquitoes, not any pollutants. So the biggest of buildings, the biggest of hotels, and I mean, why do you need a machine to bring it to 40 in a good hotel? Because the ventilation system is not doing its work. So that's the problem. We don't use the best filters as far as the air handling units are concerned in the ventilation system.
So the last point, I mean, we are in a 5-star hotel. I mean, the irony is kind of quite stark. This is supposed to provide you with great quality food and beverage, and the one thing that you need, without which you can't even live for minutes without, is good air, and that's pretty bad, and you need to bring your own stuff in. It's pretty much the same as trying to figure out how do we get the best emissions out of individual cars when we haven't really thought about the fuel quality, and even the standards around with which we can kind of enforce the manufacturers to say these are the emissions that we want and target it out.
Maybe, Bobby, I'll also go back to your original question as to what do we need to do.
Correct.
In order to, we can continue and discuss about the problem and not discuss about a solution. And I guess where we are lacking is either we are following only a stick initiative that, okay, we need this penal measure, we need that penal measure, and then we need to punish the bad boys. Of course, we need to do that.
Measure gets us to a grudge purchase.
Yes. Okay. And we need to adopt a judicious mix of carrot and stick policy.
What's a carrot?
Yeah, the carrot in this case, and I'm not limiting to indoor pollution of this hotel room probably. Now, the recent success of, in the recent, the theme of this conference is innovation, right? And I think all of us have missed out the most, the big-sized initiative taken in the last couple of years is Ujjwala. Okay. The success of Ujjwala initiative. In a rural kitchen, wherein they were using biomass to carry out cooking, it was equivalent
to wood.
Yes, twigs. It was equivalent to smoking 500 cigarettes a day. Right, 500 cigarettes a day. So what was initiated by this government? Whatever. I mean, I do not have any political affiliations, but to the credit of this regime, they looked at the issues being faced by the women in rural areas smoking up to equivalent to 500 cigarettes a day, and gave a 8,000 crore subsidy to ensure that they convert from the typical biomasses to LPG, and thereby having a huge impact on the health of the women folk of rural areas. And I'm sure in the coming years, in the coming months, you would see certainly big health research reports coming from maybe WHO and even domestically within the country about the huge health impact it has made. So we need to look at solutions. We need to look at innovations like these wherein the government can play a role as a policy measure, and then the private sector can help. In this case, the CSR funds also came in. If 8,000 crores was this, and look at the success of Give It Up. So all in all, if we have an ecosystem wherein all of us look in the same direction, and not just be critical, but also try to find some solutions, and also try to give some solutions for the complete ecosystem, it's going to help.
I wasn't giving it up. I hadn't even taken it. And I was told that I had to give up something that I hadn't taken, but that's besides the point. That's right. Kind of the way that we sometimes implement things. I want to turn to the audience. We have a few minutes here. Are you convinced that the gentlemen here have any solutions for either women and children at home or for all of us outside in terms of looking at where our air quality is going to go? Or do you have any solutions that you want to kind of, or questions that you want to pop up to them that we can kind of consider here? Yes, ma'am.
I'm impressed with the panel because 80% of the time what we spend at home at the workplace, and we are not thinking about the workplace, how can we clean? That's number one. Second, I like the way you said as far as enforcement. It is the time that enforcement is the core of the country. We cannot live in the past of the 1940 laws on everything. So we find a solution for the enforcement. Even at home, the religious practices, our bhakti, we think it purifies. On the other hand, it harms as far as the air is concerned. Fourth, the religion practices of throwing. Look at the beautiful country UK. that the polluted toys they threw away, that they were coming from China. And we are immersing the idols, throwing all the junk into our country. That to be done. So most important is our indoor environment. And I think, as you beautifully said, the ventilation system is poor. We buy the cheapest quality, be the hospitals, be the hotels, to save the money and not think of us or you at large.
Probably I just want to add,
Yes.
Unfortunately, while a lot of talk goes on outdoor air and measures that we're doing, indoor is confined to the limited set of people where you're in your office. And unfortunately, there's no standard. But however, there are standards. WHO has a prescribed standard of a certain figure of how much the dust measurement should be. And I'm really proud to say, I take this opportunity for the first time, actually announcing that CAMPHIL is going to do a large project with ITC Moria. And it's going to be one of our most prestigious projects where we are going to ventilate their entire air, and we are going to prescribe that the air inside is going to be as per WHO standards. So going back, there are certain standards in the world, and there are methods we can reach to it. And it need not be only an air purifier. We can go to the root cause, we can set up good ventilation systems, good filters in the systems, and actually live a good life 80% of our time at least inside. The balance 20%, there are a lot of policymakers helping us with the outdoor air.
Thanks. When you mentioned your project, completely laud your initiative, but I also find that to be the image that, or the paradox that we are faced with. Here you have ITC, Moria Sheraton, 5-star tobacco finance company cleaning up its air for a set of people who can afford to buy it, when the largest number of people are both victims and unable to provide for themselves the kind of air that should be a natural born right. Article 21 of this country's constitution states that there is a right to life and a certain quality of life. And if it isn't being delivered, then do I blame the individual car buyer? Do I blame the person who's running an industry and has to make a grudge purchase? Do I look at the mother, child, woman, chef, cook, office worker who's confined into a space with foul air that they're breathing in over and over again and reducing the total useful life that they have? Or is there a better way of doing things? 30 seconds, solutions please. Even if it's just ideas right now.
Dr. Bobby, it's a long-term problem, and it has to be dealt with from a policy and enforcement and implementation perspective. It's not a slapstick, one-day fix-all solution. And unfortunately, a lot of our policies are looked at from the telescope of elections. Unless we make air quality into an election issue, unless our Prime Minister speaks up on air pollution, he's spoken about Swachh Bharat, he's spoken about everything, but not a single word. We had those 20 days in Delhi where people felt that they were in a gas chamber and about to die, and not a word from our Prime Minister on air pollution till now. We need to make this into an election issue. We want people to become aware, and we want people to demand clean air. That's the first step to getting to the end result. We've filed as a not-for-profit organization, Care for Air, we filed a 12-point agenda at the Supreme Court of India as a public interest litigation for my right to clean air. And it's a very simple 12-point agenda, and if it's a long-term plan, but if those 12 points are followed, Mexico City has done it, Philadelphia has done it, Pittsburgh has done it, London has done it, Los Angeles has done it, Beijing has done it. It's Delhi's turn now. We need to do it. We need to do it for our children. We need to do it for ourselves. And in the meantime, I need to protect my children, and I will go and buy ventilators like this. I will go and do whatever I can to protect my children and myself. But in the long run, I want to be outdoors. I want to be able to go out and play my sport, and I want clean air outside, and I want to demand it from my government. I want to demand it from my Prime Minister. I want him to talk about this.
Thank you.
So 4 things. Number 1, we don't know the problem.
We don't know the problem.
So find the problem.
Okay.
So the first problem with us is we don't know the problem. There are, I think recently...
I can see the problem, Mr. Goswami.
No, we know what is the manifestation of the problem.
Sure.
But we don't know why it is there.
Okay.
We don't know exactly because, I was just looking at the Parliament question and answers.
Okay, know the full extent of the problem.
Parliament question and answers, and it clearly says the Parliament. There was a question put in, and the Ministry replied that we are not sure about what is causing this pollution.
Sure. Then that goes back to what Barun said.
No,
I want the government to tell me what is the problem. Okay.
Second, about indoor, I am very sure that we can prevent 1 million dead, 10 lakh people if we ban tobacco. Tobacco is something which we don't want, which we don't require. It's not a food, it's not a nutrition, it's not something which is required for mankind. So we need to phase out tobacco altogether, and we save 1 million people overnight in India, 5 million people or 7 million people across the globe, overnight. With pollution.
Okay, that's one slice of the air quality part of it.
Absolutely. It's a very major one.
And a big chunk. Right?
Like you rightly mentioned about ITC, the way ITC is killing people. Out of 1 million people, I would say half of them are being killed by ITC alone.
Fair enough. So two things. Know the problem and then try and figure out.
Now, the third problem. We have antiquated laws. We need to replace them. We need to be more rational. We need to understand what is the problem. We have to make proper laws.
Do you have a model in place?
Pardon?
In the same way that he's got a 12-point charter, do you have a model law in place that you can proffer? Today, if a minister is sitting here, later in the day somebody will be here, do you have a piece of paper that we can produce in front of them?
Now, like he rightly mentioned about filing a rate on air quality, so I file a rate on carcinogens.
Right.
Air pollutant is class group 1A carcinogen, which is classified by IARC, International Agency for Research on Cancer, which is WHO.
Which means we are being poisoned.
Pardon?
Which means we are being poisoned.
Poison is a cancer-causing agent. Carcinogen is a cancer-causing agent. So it's a number 1, group 1A recognized carcinogen. It needs to be put, we need to put it to end. We can't continue like this. We need to do something about this. We need to find a solution for all this. You are killing your people.
Right.
And the last thing, when I see about the government policies, I would like to mention, since tobacco is a core area where I work specifically when it comes to indoor air pollution, all that thing. If you see a cigarette or a pack of cigarette, the tax which is collected by the government would be roughly like 20 rupees or something. If someone smokes one pack of cigarette a day, it causes 1 mutation per cigarette box. That is a 2009 study. Okay, and if a person smokes for 20 years, he's surely going to die. 20 rupees into 365, around 7,500 for 20 years, 1,50,000. Is the government willing to kill a person for 1,50,000? That's a rational question the government needs to answer from the policy perspective also. And something you want to make outdoor pollution clear, and you want to kill people who are sitting safely in their living room.
Thanks, Mr. Goswami. part of the point that we are kind of larger we are making is life seems to be cheap here, and you kind of put a number here. 1.5 lakhs seems to be the going rate for the
killing one person
per life.
Per life. Mr. Sagar.
Well, I'll give you an example of the Sabarmati River. If anyone has seen this place about 10, 15 years back, it was virtually nothing but a drain. And today, see how Sabarmati is. So if there's a will, there's a way. So, when we have attacked on water, we have done it. Unfortunately, air is invisible. So probably the focus on air is losing out because of the physical feel of the air is not there, except these high-pitched reports. Otherwise, if the policymakers want it, we can make the outdoor air as good as a good waterfront anywhere. So it is possible.
Suyash.
Include clean air in Swachh Bharat campaign. That's one thing which we wrote to the Prime Minister that you have, it's not just about the dirt which is lying everywhere. Why does Swachh Bharat does not include clean air? Isn't it our right? So anyways, so that's one part. And then I agree, as you said, demand clean air. So all of us probably need to make this a part of our push that Swachh Bharat should include clean air, and not just for Delhi. And it's, across all the polluting cities. We have the dubious distinction of the best of our cities are the most polluted globally, the most industrialized of our cities. So that's where we come to. And then finally, we need to create an ecosystem. And that ecosystem can be managed only if we incentivize the adoption of newer technologies, give out liberal tax incentives, liberal subsidies for leapfrogging old technologies, the rules of 1943, 1947, 1950, the Factory Act, and come up with the latest ones, the benchmark the levels of, I mean, 15 years later, I'm sure the conversation is going to be different, because we are certainly looking at solar, we are looking at EVs, and renewables are going to take over 15, 20 years down the line. But what do we do for these 15, 20 years? Do we die a slow death? If not, let's get working towards a solution. So.
Ladies and gentlemen, thank you. Thank you for your comments. I want to kind of summarize, pull these together into a summary for ourselves to think about. What are our takeaways? We can spend money at an individual level and buy cigarettes. We can spend money at an individual level, buy bad household fuel or household cooking choices, or polluting vehicles and bad fuel to kind of run them in. Those are all at individual choice and individual purchase levels. We can tolerate emissions from factories and from our vehicles to a point where it kills us all collectively and makes our cities into gas chambers. We can tolerate factory acts and poorly enforced environmental laws till we all collectively die coughing our last breaths. Or we can incentivize for ourselves both a switch to better, cleaner fuels at home, ujwalas, or the transition to, or the incentives for cleaner, better emission standards cars. Or we can look at providing incentives for industry to move away from grudge purchases to actually do the air filtration, air quality emission, scrubbers, all of this like that are being produced, and for which it could be actually a tax break that could allow us to move in. We can actually incentivize a faster move towards renewable energies and move away from our fossil fuel dependencies. But it will take many of these things together to work all at the same time. We do not have the luxury of working at each of these sequentially. That we will solve the tobacco thing, we will solve the indoor air pollution with Ujjwala. Once Ujjwala coverage is gone, then we'll look at the cars, then we'll get our Bharat 6 emission standards, then we will tell our refineries to get better fuel, then we will tell our factories to kind of get the scrubbers in place. No, all of these need to run at the same time. The question for us is, do we have somebody, or do we have a set of somebodies who are holding all of these together at the same time, so that collectively we can breathe easy? Thank you, gentlemen, for your time on this panel. Thank you for some of you that questioned, some of you that had some numbers for the air quality index. Remember, while it may be invisible, and so therefore we may not pay attention to it too much, it is vital. The air that we breathe, the quality of it will determine how long and the kind of lives that we will live, not just for ourselves, but also for newborn children like Kamal's. Only 12 days old, and their lives will be impacted by the kind of air and the environment that they're going to live in. That's food for thought. Thank you, gentlemen, for this time.
Thank you.
A round of applause to them.
Mr. Kamal Narayan, to please present the panelists with a memento for the evening, for the summit. I also invite Mr. Amitabh Sharma, Vice President Marketing, Blossom Kochhar Group of Companies, to present a memento to the dignitaries. Okay, first photo session, then mementos, fine. Mementos for Mr. Hemant Goswami, Mr. Barun Aggarwal, Mr. K S V Sagar, Mr. Suyash Gupta. Dr. John, you can join the... Thank you.